Good. So you have blurred your background?
No, wait a second. I did not blur my background. So, background. Blur the background. Slightly blur your background.
Sir, वो second वाला option है, blur your background completely. You can click on that.
तो ये कर दिया.
हाँ जी. ठीक है, sir. Sir, looks good, sir.
Looks good. Okay.
Yeah. Good. So, sir, we are just 2 minutes away. We already have people joining in. So, we'll start the recording. The flow will be, sir, Prateek will briefly introduce this, our platform, which we do every third Sunday.
Yes.
Then I'll introduce you and I will play the slides, sir. And you can then, of course,
elaborate on that.
Yes. No one can do justice, sir. Instead, just only you. So I'll just try to briefly introduce. So, your illustrious, your achievement, I cannot capture.
I'll tell you in half a minute. I'll tell you. Recently, I went to a shop or something, and some agency selling some goods. So they said, this is this, this is this. So this is price is like this. I said, good. So I'll buy it. So then he says, but you are a doctor. So I'll give you a discount.
Right.
You are like, you are a doctor and you are next to God. You are like God.
Right.
And I was like, okay. Then don't give me 10-20%. God is telling you to give 50% discount. You yourself said, yeah, I'm like God. So you have to respect your own words. तू नहीं बोला मैंने तो बेचारा बोलता है सर ऐसे कैसे तो ऐसा भी होता है.
सर शुक्र है उसको हार्ट अटैक नहीं आया, नहीं तो आप ही को सेव करना पड़ता.
Yeah.
Okay, so I think we're touching 11:30, Dr. Rahul, and let's kick start. So formally, I think good morning, everyone, and a very warm welcome to today's session. मेरा नाम प्रतीक है, प्रतीक महेश. I'm the co-founder of Insure Joy and My Assurance, and it's truly a pleasure to have you all with us today. So just before we get into the session, I think I'll take a step back and kind of introduce what we at My Assurance are trying to do. So at My Assurance, I think we host these webinars every third Sunday, as Rahul was mentioning, every third Sunday of the month, with a clear mission to promote prevention and reduce avoidable hospitalization. So our goal is to help people, companies, maybe insurers, and the entire healthcare ecosystem by focusing on awareness and proactive health measures. So according to us, prevention isn't just good for individuals. I think it's smart for the industry too, right? So today's session is actually a perfect example of that vision in action, right? So I'm deeply honored to welcome Dr. Suresh Bhagia, a leading cardiovascular surgeon and author of the eye-opening book, How to Bypass the Bypass Operation. His insights challenge conventional thinking and empower people with real preventive choices for heart health. Moderating today's session is my co-founder at My Assurance, Dr. Rahul Verma, who is deeply committed to transforming how we think about healthcare and prevention. Before we begin, please drop your questions in the chat. We'll take them up during the question answer at the end. The webinar is being recorded, and we'll share it if anybody wants it. So with that, I'll not take much of your time, and I will hand over to Dr. Rahul Verma to introduce our distinguished guest and take the conversation forward. Over to you, Dr. Verma.
Great, thanks, Prateek. And I think I'll reiterate that there is, our vision and mission is to see that we are able to prevent avoidable hospitalization, right? And with that, we are really honored to have Dr. Suresh Bhagia, an eminent cardiothoracic and vascular surgeon, with over 25 years of experience and a pioneer in heart block and diabetes reversal. Like Pratik mentioned, he's the author of the acclaimed book, Bypass the Bypass Surgery, which is available on Amazon. We can share that link if you want to, read that. I have personally read it. It's a very insightful book and impactful book. And he blends deep clinical expertise with the holistic healing. That is what is required, right? And if we are able to combine, nutrition, meditation, and exercise all together, he's the one who has been able to bring these together in a magical proportion and create that magical formula for reversing heart blockages, right? He's worked with some of the world's greatest heart surgeons and inspired by the mission to make heart care accessible and preventive. Dr. Bhagia has dedicated his life to empowering individuals to reverse chronic lifestyle diseases naturally. Though his vision is bold, but it's very simple: a healthy heart and a diabetes-free world. And, I'll just say one more sentence and hand it over. Before the call, I was saying that whatever I say, I'll not be able to do justice to what he has achieved, what his capable and, laurels are. But if there was an Oscar for heart surgeons, Dr. Suresh Bhagia would certainly get the Best Surgeon Award globally every year. So I think that is the impact that he's trying to bring. So I'll hand it over to Dr. Suresh Bhagia to briefly introduce. And I will also, sir, bring up the slides and we can go through them, sir. So over to you, Dr. Suresh Bhagia. Let me just bring up the slides as well, sir.
Yes. Meanwhile, thank you very much for the kind introduction. So I am basically a human being first, and then a doctor, and then a heart surgeon, and now also a holistic heart healer, meaning a lifestyle medicine expert. I recently got certified from the American Board and American College of Lifestyle Medicine. So I'm combining allopathy with lifestyle medicine and even Ayurveda and naturopathy. And I had the opportunity to interact with the best heart surgeons in USA, UK, train with them, as well as interact with Mr. Bill Clinton. I say everybody a doctor. Mr. Bill Clinton's physician or doctor, Dr. Caldwell SL. So he's 90 years old in Cleveland Clinic, Ohio. And he said that you must try this thing, because he did a lot of cases reversal of heart disease and blockages with natural means, with only diet. I just added that element of Brahma Kumari, that is meditation. So that is, I put in diet, meditation, and then some people, Ramdev Baba's yoga also. So it's a triple thing, like a Trishul, we call it. And it's a 3-stage thing: diet, meditation, exercise. And we'll tell you how it is later on. It's called DI, diet, M, meditation, E, exercise. And it's like dime. And you get it for a dime. So I think you should all use this opportunity and take care of your health and become heart healthy. So we can...
Just 1 second, doctor. Rahul, yeah. Are you able to showcase the slides? Because I can still see the first slide.
Okay, just give me a second. I was actually moving the slides. So let me just share again my complete window.
Yeah. And doctor, by the time Dr. Rahul is making this shift, I think majority of our people are Hindi and English speaking. So for the audience, I think English would be the best way forward. Right?
English. Okay.
Yeah.
Fine.
Yeah.
So is this, are the slides moving now?
Yes, now they are. Yes.
Okay. Yeah. So I think this is the best slide, Dr. Suresh. So probably you can share from APJ Abdul Kalam sir to other prominent cardiothoracic surgeons. Yeah, please.
I mean, like, these are the world's best. Like number one, actually, this guy did the first, aortic valve surgery, Dr. Michael DeBakey in Houston, Texas. Then Dr. Cooley, if you just get into Google, he's a legend. I mean, he is the number one, and he did the first human heart transplant in USA. And Professor Magdi Yaqub was given the night shift by the Queen for becoming the UK's best heart surgeon and doing the first heart transplant, as well as pioneering many techniques. And no heart valve surgery is complete without Professor Carlos Duran. He made artificial heart valves and heart valve rings, and which we use so commonly every day. So yeah, I could interact with them, learn from them also. But yes, I am an ordinary human being, and I went in the small town, Baroda. I'm sitting there right now, Vadodara in Gujarat, and I dreamt to work with Dr. Cooley when I was 6th grade or 7th grade, like 12, 13 years old. And I collected his, journal articles, and I could fortunately work with him after I did my MBBS and Masters in Surgery from Vadodara. Next slide. So also to keep my heart healthy, I do meditation. I also am a skilled musician, and I got an album also. So I play the alto saxophone, very good, in the night it's very sweet sounding and melodious. Yes, my boss told me to train with both the hands. So surgery does look stylish when you do it with right and the left. And indeed, I love heart surgery. But as you will see that after Corona, I realized that one can do a lot more than only heart surgery and treat these patients with heart blockages with even holistic health. That is like looking at the overall picture and not looking only at the heart, but their mind and kidneys and social conditions. So, yeah, next slide. So that is how I came to this program and devised this program. So we founded DIME. It is now a registered trademark. Actually, I applied, and I was not like a businessman, but I have become an entrepreneur, and I applied for a TM, registered trademark, and now DIME is with us. So right. It's a regular TM. And yeah, I do believe in like Tata physiology. I mean, like, Tata philosophy. You help the people, give value to the people, and not like Ambani, you just collect the money. So money will come as a byproduct, not for service, basically. And the human heart beats in a day more than 1 lakh times. You can imagine how powerfully and strongly, and I mean like regularly it is beating. And heart attack deaths per year in India are like 27,000 or even more now. And these are statistics from 2 years back. And heart bypass operations every year are like 6,600,000. And cardiovascular death is the #1 cause of death, more than any other thing like cancer or even accidents. It's like 5 million. And corona deaths in 2020 per year were amounting to almost like 4.5 lakhs, not 45 lakhs. So that is also a big number, but that is like infectious disease. So the leading cause of death is unmistakably cardiovascular disease. Next. So mission, this is a slide. I think we can, in a way, mission can be not even 1 million, it can become 10 million. This is just to write here, but I think the impact can be huge if people we treat can be really managed with our thing. And vision is to make chronic lifestyle disease reversible and make it easy, and we empower the entire population to lead life in a healthy way. And I will emphasize, I don't know your professions, but like health is wealth. Wealth is not health. Like there is a guy, or there was a guy now, Mr. Rakesh Jhunjhunwala. So stock market champion, expert. 42,000 crores. His last sentence or his last advice to the population was, to Indians, take care of your health. Don't be like me. So because he died of heart disease, he died of kidney failure, he had, I think, diabetic foot also. So very simple disease. Had he taken care of his health, he would have enjoyed. I know Hindi is not good here on this platform, but I'll tell, jo bhog sake wo bhagyashali. I mean, those who can, enjoy life, they are the lucky ones. If you have 5 crores in your pocket and cannot enjoy, then I think it is futile. You should be so strong and healthy that you eat a gulab jamun or jalebi and your blood sugar is just 100 or 150 because your pancreas is good. So that's how we have to make ourselves, that we can enjoy everything and nothing happens to us. Next, please. So now the power of why. There is a book, I think, The Power of Why. Why this? Why am I doing this? So it will resonate with you. It will connect with you. So I have seen very bad coronary artery disease. Yesterday I did one operation. I can see the slide, but it's very messy, bloody, like it's bloody surgery, so bloody messy, and the bloody surgeons do it. So I have seen bad coronary disease on the operation table, and yesterday also there were 3 arteries blocked, 3 blockages. I'm asking Rahul, should I go into the detail that how many arteries are there or not necessarily?
No, please, sir. Please, sir. Please.
So, like, there are 3 coronary arteries. One on the left side, that is left anterior descending, also called the widowmaker, because if that is gone, the person dies and then leaves behind a wife who is a widow. So it's called a widowmaker. So maybe comic, but it's very serious. So LAD. Then another one is circumflex artery on the left side, and on the right side is the right coronary artery. So there are 3 coronary arteries. So even in yesterday's case, I could do only 2 because third one was like so thin, less than 1 millimeter, and fibrotic and calcified. You cannot even put a graft or do anything surgically. So we had to abandon it actually. So even though the chest was open, the surgeon is there, the patient is there, doctors are there, but we are helpless. So why should we get into such a position when we cannot even do something to help you? And in Corona especially, I saw patients dying in their homes due to curfew and not coming to the hospitals in fear. And meanwhile, some patients, I realized that they could actually reverse their heart disease due to food shortage. They could not go out to buy food, and they were doing intermittent fasting or starvation, compulsory, without their, without their will, unwillingly. So, not eating food, or especially non-vegetarian food, and not even milk, because milk has got a protein which causes cancer and heart disease. I know it's a very strong and tall statement, but this is research proven. I can share you some articles if you want later on, that how even milk can be deadly as far as heart disease is concerned. Okay, next. So I interacted with this doctor, and he was a friend. He's still alive, of course. He's a friend of one of the pioneers of heart surgery. So very paradoxical. This fellow is into chronic lifestyle disease management, and the other guy is a surgeon who is into operating and cutting, opening chest and doing bypass surgery. So he, along with Dr. Colin Campbell, in the China study, very famous book, China study. You can see it on Google. And in World War II, soldiers were becoming healthier as a result of eating less, and there was a famine and they were not getting meat. So they were becoming healthier by starvation, intermittent fasting, or prolonged starvation. And then I studied nutrition, took courses in diet and Ayurveda and yoga, and contacted him personally. I had several meetings with him on Zoom. I did not, he's telling me to visit. So maybe I'll visit in the near future, Cleveland Clinic. And then he said, it was like he speaks for 4 to 6 hours. He's 90 years old. He's full of energy because he maintains his lifestyle, his nutrition. So he even cycles maybe like 5-6 kilometers every day on a bicycle, 30-40 minutes exercise, everything. So I said, whatever you are doing is good because it's keeping you healthy. So he shared the secrets, and he has written a book and how to prevent and reverse heart disease. If you just Google Caldwell Esselstyn, so that book is there. So inspired by him, I wrote my book, the Coronary Bypass Surgery. So that also became an Amazon bestseller. So it's available on Amazon. And then next, please. And there are 3 key steps for the reversal process. And you will be surprised that actually heart blockages can reverse. Even calcification can reverse. It needs discipline, it needs perseverance, persistence, but one can do it if one has the right mindset. So one is eating the right diet, nutrition, stressed by everybody. And people will say that I eat regular chapati and rice and sabji, roti and everything. But that may not be enough. And it has to be combined with fruits and vegetables in the raw form. So then it becomes the right diet. And mindful meditation, like you meditate to reverse the heart disease, you can do affirmation and visualization and even breathing techniques. So that we have, set a pattern which people very well do it in 10-15 minutes and they get the benefits. And step number 3 is exercise. Sweat it out is written here, but we don't actually want that. Sweat it out. We just want 40-50 minutes of walking. Those who have knee joint problems, they can do swimming. Others can do cycling, or if not, then they can even do yoga. So anybody can do it. Next, please. So right nutrition, I will share a secret free of cost, that you should start your day with green juice. That is spinach, then mint and coriander and fenugreek. So these 4 things, along with a dash of lemon or some black pepper and even cayenne pepper. I got lots of information which I can add on and give. So once you do that, your body is ready and it will detox. And after that, you start your breakfast. So in the night, you eat nothing. First thing, you have green juice or red juice. Red juice is like beetroot and carrot. And then you start your day with breakfast, little late breakfast, 9-10 o'clock. And then you'll be okay. Also, the saliva converts the nitrates of these green leafy vegetables into nitrite and then nitric oxide. So nitric oxide is the most potent vasodilator on earth, in the whole world. So nitric oxide opens up the blood vessels and your blockages get cleared. So you don't have a heart attack, basically. So Dr. Caldwell Esselstyn even claims that we can make them heart attack proof. And the whole thing is about the battery, If your battery heart is okay, your mobile will work. So same thing, your body will work if your heart is okay. So you have nitric oxide as the main thing. If your nitric oxide is good, you become heart attack proof. You cannot get a heart attack. So you don't go to a doctor or have high bills and waste time and everything in the hospital. Next. And there are some superfoods very common on the internet, Google, you'll see them, like flax seeds, that is omega-3, and again omega-3 walnuts, almonds, but only 3 or 4 pieces, not more. More if you eat, it is cholesterol. If you eat 4 pieces or less, it's healthy. It is HDL. So high density lipoprotein. And pumpkin seeds and sunflower seeds. Then we have got wheatgrass. You can have it as a powder or a juice. Moringa. Moringa is very good, helpful even in diabetes and even in all chronic lifestyle conditions. And you can do intermittent fasting, start with 12-12, and then go to even 20 and 4, like 20 hours of fasting and 4 hours. That may even reverse your age, actually. There is a guy called Dr. Brian Adams or like that. So he has reversed his age. He looks 47. He's 57, but he looks 47 because he eats only 4 hours from 7 a.m. to 11 a.m. So if you eat only in the morning and respect the circadian rhythm, then your lifestyle is, I mean, like very disciplined, and you really reverse your aging. Your hair becomes black. He has even said that. It will be on Google. I have not mentioned the name here. I think it is Brian Adams, but it will come very strongly on Google. So he eats only 4 hours in a day, 7 a.m. to 11. And not easy for us to follow socially and like physically, but I mean, those who can try, they can try it for 10-15 days and see. Effects will be seen even in 10-15 days. You'll feel the whole body is changing. And also on an empty stomach, this is very common now. All the quacks and babas are saying, but of course there is some substance in it. ACV, that is apple cider vinegar with 5% acid, and along with lemon and ginger, some people add honey. So in a glass of water on an empty stomach, if you take, this also reverses heart blockages and even helps in reversing diabetes. After a month, you will see the changes. Next. So as you can see, these results are proven. There is a guy called Sailesh. So this is just an example of the many. He had triple vessel blockages. So his son was in USA. He said, okay, father, you do your surgery. I'm coming. This fellow said, no cutting. I don't want surgery. I'll do vegan diet or some plant diet. So his blockages, which were 90% blocked, went to almost half, 50%. So 50% is like normal, and doctors will not advise surgery or angioplasty for that. So now he is hale and hearty, and he is in Jamnagar. He must have gone for a shibir or like a medical camp, which is going on. So they do ekahar. Ekahar means now this is a mango season. So 5 days they'll eat only mangoes. Or in the grape season, they will do only grapes. So juice, grapes directly eating. And that also detoxifies and then reverses the blockages. Not in 5 days. You have to do this for 1 or 2 months. And then if you do angiography scientifically or repeat your blood tests, you'll see that the changes are there. Next. Second component of this DIME program is M, that is meditation and mindset. So we focus on the breaths, and Brahma Kumaris are almost pioneers or very advanced in this kind of thing, in meditation. But they are very intense. They have to wake up at 4 and do it. our program, you can wake up at 7 and do it. They can do it at noon time. Basically, it's meditation. And any kind of meditation is good. You can do pranayama, focus on a candle, or vipassana, or enjoy a hobby, get in the flow state meditation. So, and start with 15 minutes, and you can go to 30 minutes, and this will help in reversing the heart blockages and even thyroid disorder or diabetes or high blood pressure, anything. All chronic lifestyle disease. Next. And then we come to E, that is exercise. So in that, there can be two components. One is yoga. You do postures. So there are specific yoga postures which will open the heart chakra. It's called Anahat chakra or heart chakra. The number 4 chakra. There are 7. So that will open that one up, and your heart blockages will start reversing, and all other chronic diseases also will stop. And you can walk in nature with trees and mountains. Basically, you keep away from stress. You can do it alone or in a group meditation. Next, please. And again, this kind of result is proven. So there was this guy who had a blockage of 80%. He was advised single stent angioplasty. And he followed the diet plan, and his blockage was 40% after 3 months. And we do this scientifically. We don't do just like randomly that, oh, it will become like this, like a Baba. So we prove it actually to you, that your angiography is before and after, or your blood test cholesterol before and after 1 month. In 1 month, many times I got many WhatsApp things here, and from Dubai and Mauritius and like Chennai and Bangalore, Delhi, that their results are like 147 cholesterol from 210, and now no medicine, nothing. Before on medicine, now on nothing. So they have mastered their lifestyle, and they are eating normally, normal healthy food. So it's nothing abnormal, we say, that you don't eat anything or something. So this fellow prevented his intervention, like bypass surgery. He bypassed the bypass surgery and even angioplasty. So this is a good thing. And yeah, the why. So I'll tell you about why I also did this. Also, despite our best efforts, sometimes two people out of 100 will die in the ICU, because it is surgery, it is angioplasty, it is artificial thing, invasion in the human body. So body is not supposed to be for surgery. It is supposed to lead a normal, healthy life. So once we do that, whether the body does not accept this operation, or like cannot sustain this kind of thing, or maybe some error also by the medical officer, some small things, some drugs here and there, so the patient may expire, 1 out of 100 cases. So why should that one person expire? So in this one, nobody expires, 0, because there is nothing we are doing. So also, secondly, we have a backup plan. Like I have friendship with 500, not 100, 200, but 500 heart surgeons in India. So if you are located anywhere in India, I can refer you if at all I feel that the program is not working on you, or you are going downhill, or you need urgent attention. So I can refer you to Dr. Devi Shetty. I have his personal connection, Dr. Naresh Trehan, or Dr. Ramakant Panda, Mumbai, or Bhattacharya, or I mean, you name it. These are my senior colleagues and friends, and we are in the fraternity. So I can refer you in Kerala, Bangalore, Aurangabad, Pune, wherever you want. So you do this program, anything goes off, immediately I can say, okay, sorry, now you go for the next level. So that is always there, life-saving. So not like, see, Ramdev Baba, he cannot do anything. His program will work. He is very good. I like him. But if something urgent happens, he does not have a backup. He has to refer to hospital for surgery or any intervention. Whereas we have the backup, real scientific backup. So that's why this one is good. Your lifestyle management with backup of allopathy or hardcore heart surgery, high-end technology. Next, please. And third one is exercise, which we covered with yoga also. Yoga is a blend. It can go into meditation also and step 3 also. It's intermixing. So number 3 is exercise. So this hardly forms 10 to 20% of the program. It helps, but diet and meditation take the upper end. And here we have got anti-gravity exercises like calf raises and raising the hands above the head 20-30 times. Your blood sugar will go down by 20 points. You can try it even today. So if you are sitting on the dining table and you eat the same lunch today and check it 2 hours after, it will be 200. And if you do these exercises, which I show you, it will become 180, that thing. And you will not move from the table. You are doing it while sitting and eating on the table. And 100 times of calf raise like this. So like on the toes, raise the heels, again toes down. And you will see that your diabetes is controlled. Or you could some technical glitch.
రకాలుగా కలెక్ట్ చేయొచ్చు, అన్ని రకాలుగా చేస్తుంది. Yeah, I think some technical glitch, doctor.
Yeah, looks like that. Okay, people are joining back. Okay, shall I bring up the slides again and we continue, Pratik?
Yeah, we should. Yes.
Dr. Suresh, you are okay? Dr. Suresh, you are on mute. Pratik, can you request Sudhir to unmute the doctor?
Yeah, he's doing that.
Yes. So we are back. Yeah, I mean, this happens, I mean, this is better than COVID at least. COVID, you could not go out for 1 month. At least this is just 10-20 seconds. So that's yeah.
Okay. Yeah, please. I think, Dr. Suresh, you were talking about very simple exercises like just the calf raises,
Yes.
slow calf raises, and just your arm movements. If you do, let's say 100 times, like you mentioned, then your blood sugars will start getting much more controlled.
Yeah. Or even actually, I have experimented with these people. So even with putting like this, there is a patch, CGM, continuous glucose monitor, CGM patch.
Right.
And if they even eat maybe a jalebi or like a very sweet thing, maybe gulab jamun, and they don't want to raise their sugar. Suppose they want to show it to a doctor or something, and they put just cinnamon powder, black pepper, wheatgrass, and cardamom. In that, the sugar will not rise that much. So instead of 200, it will go to just 150. So it's like these things are very protective. Or moringa powder. So if you add just a pinch of these things and eat it with your dessert or something, then your thing does not go up. So these are all small.
Dr. Suresh, please repeat this. This is going to help everyone on the call.
Yeah.
I've been longing to eat jalebi. Now, if I just have to put these small things, on my jalebi, I'll go ahead and eat jalebi in the afternoon.
Yeah, I'll tell you. So cinnamon powder, very small, half a pinch, like not even half a spoon. That much, sprinkle it. Then wheatgrass. There is wheatgrass powder available.
Right.
Then you have got little bit kali mirchi or black pepper.
Right.
Then you have got moringa powder. The drumstick thing.
Right.
So that powder. So these four, if you put, and then if you eat even a sweet dessert or something, your sugar will not bump up that much. These are all anti-diabetic drugs.
So, simple layman question: do I eat them along with the dessert or after? How do I take these?
So, if you don't want to spoil the taste or enjoy the taste of gulab jamun, do it after that. You can put it in a glass of water and then drink it like medicine.
Done.
So that should take care of it. Yes. So
I think that's the key takeaway, doctor. So for all the people on the call,
or even maybe apple cider vinegar.
Right.
Maybe just 3-4 drops of apple cider vinegar with that. So that will avoid your jump in the thing. And chia seeds. Chia seeds also, if you put maybe half spoon of chia seeds in that mixture, then it will act as a fiber coating, and then your sugar will not jump dramatically.
Right.
Yeah. So next, and this is just if you keep connecting with me, I'll give you more things.
Certainly.
I got many things in that one. So exercise, like even walking can lower the LDL. LDL is the problem. HDL is the good cholesterol, and so that is the HDL. So walking increases the HDL and reduces the LDL. And even gym going persons are having heart attacks. We have seen gym people dying because of faulty diet and poor circadian rhythm. So there was a cyclist from Bangalore or Chennai recently. He used to cycle 100 kilometers daily, century, and 100 days something. He also died. He was very fit. He was eating healthy, but his problem was circadian rhythm. So if they don't sleep between 10 and 5, or maybe 11 and 6, if that window is not followed, then slowly your hormones get off balance and you get diabetes, blood pressure, and you cannot sleep for 6 hours in the afternoon. You have to follow the circadian rhythm. So after midnight, sometimes if you are working, then it's a problem. So one should avoid. It may not happen suddenly, but you have to train gradually. Once in a while is okay, but regular midnight is a problem. And anyone having issue with exercise related problems, we can solve it. Like we can give alternatives like yoga and swimming, and because some people might have knee joint problems. So they'll say, how can I walk 4 kilometers? Because we suggest 7,000 steps daily. 7,000 steps is almost 6 kilometers approximately. So that much I think one should do to keep the things in check, especially those who are having disease like heart disease or diabetes, like that. Next, please. So this fellow, so again, our program caters to low pumping also. Heart pumping is like 15% heart pumping. Normally 60-65%. It is not 100%. So if this heart is like a ball, there is 100 ml. So when it squeezes, 65 ml should go out. 65% should go out. So that should happen. But if only half goes out, like 50% or 30% is remaining, then it's a problem. So basically, it's ejection fraction, the contraction power of the heart, squeezing power. So this fellow also, Narayan, also followed this vegetarian diet. There is a controversy about vegetarian, non-vegetarian, that we can explain personally or like people who get inside this program. But preferably, vegetarian or even vegan gives the best optimum results. And he's okay, and he has managed to bypass the bypass surgery. Next. So in conclusion, we can say that some heart blocks may be tough, like even with calcium, they do CT angiography, there is calcium inside and more than 200, 300. So they may need bypass surgery. But basically, you should do DIME program or like holistic heart healing, because bypass is not the answer. The root cause is still there. So there is a traffic jam on the road in Bangalore, Hyderabad, Chennai. There are 100 cars on the road. You build a bridge or you go from the side lane, the traffic is still there. You have not removed the traffic. You have taken another route. So your root cause remains. So basically you have to treat, you must treat the root cause. Otherwise, you'll again get the blockage and you'll go for a second surgery, third surgery, angioplasty, and keep on doing intervention and nothing will happen. So that is another reason why I did this, the power of why. And we do this scientifically, so we prove it that your thing has improved. Why do you see the doctor? Because you are having symptoms or you are having blood tests or ECG abnormal or some results which are abnormal. If you are asymptomatic or if you don't have blood tests abnormal, then you will not visit a doctor, or the doctor will not say you do this or do anything. He will not say go for intervention. So our aim is to make the patient asymptomatic and test-wise normal. So we do ECG, echocardiography, CT angiography, or even routine angiography, and blood tests like insulin levels and blood sugar levels and insulin resistance levels and HDL and homocysteine. So we show it to the patient and his doctor, his or her doctor, that now the tests are normal. Now what do you want to do? So they say, okay, now we cannot do anything. We don't want to do anything. So then that is success. It is success for the program and the patient. So aim or like target is achieved. Next. So we American College of Lifestyle has got 6 pillars of medicine. Like lifestyle medicine has got 6 pillars. We squeeze them into 3. Their 6 pillars are like, one is sleep, second one is social, third one is stress, management. Then another one is fingers. Fingers meaning like smoking and alcohol, bad things with the fingers. Then feet. Feet means exercise. And third F is food. Food means like nutrition. So we combined all these into 3, and they are all interconnected. So meditation will give rise to social connections and sleep management and mindset change and stress management. Exercise will give rise to yoga, and nutrition is food. And then once these 3 are there, you avoid bad habits. So like smoking, alcohol. Again, once in a while, if somebody does once a month something, nothing happens. For that also, we have techniques. Like one guy from Dubai says that I drink once in a month when there is a friends gathering or some social party. So I said, yes, the next day you do coconut water fasting. So next day you do the whole day coconut water, nothing by mouth. So day and night you just drink coconut. So that will be fine. That will compensate. It will detoxify. So if at all you smoke a cigarette on Sunday and one drink, next day, Monday, you do coconut water fasting or just grape juice fasting, or like watermelon fasting, or just one substance fasting. That will detoxify everything and balance out. Because one meal, one burger and French fries meal will take down your progress, like whatever you have done so far with this, by 3 days. So one single meal, if you have one burger in McDonald's and one French fries and Coke on Monday, you are like eliminating Tuesday, Wednesday, Thursday. Or like, I mean, the previous 3 days, Friday, Saturday, Sunday. Whatever you are doing with this fasting and green leafy vegetables, all that is gone. So you have to start again. So it's so powerful and bad. And hopefully the government will do something about this. But so far, KFC and McDonald's is going on. It's a very big industry. Next slide, next steps. Yes, so this is like a 90 days approximately course, 3 months course, and you start seeing the results from blood test results from the first month. Your cholesterol and even diabetes. So diabetes reversal is very easy. In 1 or 2 months, most of them will come out of, if they are type 2, will stop their medicines. Mostly, most of them, like 90% will stop their medicine in 2 months, diabetes. And then once that is done, then after 3 months onwards, we can see that cholesterol also 1 month mostly they stop. And from 3rd month, we see the reversal of heart disease. So that's why we say 3 months. And some people might take 6 months or 9 months. But by that time, they are tuned to the lifestyle, so they continue doing on their own. They don't need our help. So we are not here to sell our products or services or something. So once 3 months are over, if they want some help, they can continue asking us, or otherwise they do on their own and they'll be fine. So next, okay, so this is, yeah, so you can contact this number and we can give you a diet chart for $1, maybe in a dime or something, or if Rahul wants free. And and then if you want to enroll in this program, that is fine. Consultation for your specific problem you can do, or if you feel that 2-3 doctors are telling you to do bypass surgery or angioplasty and you want an expert opinion, 2nd or 3rd opinion, then or like you have done bypass and again you have got blockages. Now, should I do second bypass? So you can ask, and I can easily tell you whether you are the right candidate or you should do this bypass or not, because we'll see your ECG, your pumping, echocardiography, etc., and then tell you whether you can still take a chance with this program, or you actually have to go for intervention first and then you do this time program to get to the eliminate the root cause. And anything else is there, or this is the last one?
This is the last one, Dr. Bhagia. So again, yes, please continue.
Thank you very much. And then I think if some people have got questions,
yes,
we can take their questions. And,
no, thanks a lot, Dr. Bhagia. I really appreciate the simplicity with which you have addressed this problem. I'll be honest in admitting here also that I am also a heart patient, right? And I used to think that, I'm invincible at 40, 42 years of age, running marathons. You took an example of this Bombay athlete who cycled 100 kilometers every day. So I used to run marathons every week. But what is going inside your heart, if you're not taking care of your diet, if you're not taking care of your sleep, you don't know, right? And I see that, yes, heart attacks and cardiovascular disease and diabetes is the leading cause of death and reduction in quality of life. Right.
Yes.
So what we want to do is not only prevent lives, but I think I echo that we need to also see how we can help people improve their quality of life. Right. So I think it's been a wonderful, insightful session, meaningful session, Dr. Bhagia. So Prateek, any questions we have got that you would like to address to Dr. Bhagia?
Yeah. So Dr. Suresh, just very simply, you spoke about 600,000 surgeries happening, bypass surgeries happening across the world. So if people start to believe this, right? I mean, and this is a lifestyle disorder because of which, I mean, majority of these surgeries can be avoided, right?
Yeah.
I mean, I don't want you to give a number, but what proportion of these surgeries can be avoided if people start believing in or follow the routine that we spoke about on this particular webinar? Yeah.
So this heart surgeries are like of two types. We'll just divide them into two types. One is like congenital and valve disease. On one side will be like congenital and or let's say on one side will be the heart blockages, coronary artery disease. So bypass surgery. That is one section. Second is all the rest. That is like people having heart holes, holes in the heart from birth, or like cardiomyopathy, or like heart valve disease. So these things you might need surgery. These cannot be corrected like with diet, because they will have to be corrected with intervention. But heart blockages, which form 80%, that is the answer. So 70 to 80% of our work is mostly this. So 70% can be avoided with lifestyle. It can be prevented, or we can even avoid this. Even if they have it, we can reverse and then. So we prevent, halt, and reverse heart disease. Prevention is better. Prevention is better than cure.
Wow. Well, that's a massive number. I mean, yesterday you spoke about the government's, what are they doing about it? I think yesterday was World Liver Day, right? And Prime Minister Modi was actually talking about, food being the medicine, right? That was actually the subject line of yesterday's initiative as well. No, so but I think government may not, exclude burgers from India, but I think they are doing their bit in bringing this to the forefront as well, right?
Slowly, a movement is there. Yes.
Yes. No, so Dr. Rahul, you have any questions? We move on.
No, I think the key point, Dr. Bhagia, is that when do I, see that, no, I should try this out? Because, when most of the people who have heart disease, they go, the heart surgeon usually declares it as an emergency, right? That,
Yes.
if you don't get operated now, we don't take guarantee whether you will reach back home or not. So if there are certain guidelines that, if you're either, blockage is this percentage, your sugar is this, or your symptoms are like this, then you can try this program for 3 months, because it will take a few weeks for you to reverse these changes. So
Yes.
any insights into that, I think, will be practically very helpful for all.
Yes, and also people will be afraid because the family is into pressure, and they are saying, what nonsense will you try with this? And like 3 doctors are saying you do bypass, and now suddenly you are saying go for try this. Don't do anything like this. Don't do stunts. Let's do the bypass and let's finish it. So that's what normally happens. So the guidelines will be that if there is a repeated heart attack happening, then we have to offer him surgery, bypass surgery. But if it is the first time and he has survived for 2 days, 2 days he has lived on, he has come out of the heart attack, then he can take a chance. Because the rest is all a fear factor imposed by the medical fraternity. So after 2 days, nothing happens, because I have seen people who have been advised heart surgery 5 years, 10 years back, 90% stenosis, and they are still happy and living. They may be having some chest pain here and there sometimes when they indulge in some heavy activity or something, because this is a demand and supply thing, heart attack. So if you walk fast, you'll get, and the supply is not enough, the narrowing part will create a heart attack. But if you continue your normal routine, nothing happens to them. So they come back to me. They did not have either money, or they were afraid of surgery, that they are not taking any medicine. Some are not taking even medicine. They are still alive. So all this is a fear factor imposed by the thing. Rarely it may come true. One or 2 out of 100 may die, but they may die because of the fear, not because of the heart thing. So I think the criteria. Also, second is, like, if your pumping is going down, if your heart pump echocardiography on the 2nd day, on the 5th day, on the 10th day, you do echocardiography, it is going down, then I think you should give him the chance of bypass surgery. And then later on, this kind of program. Because if your heart pumping is going down, you are having a serious issue, and you cannot take a chance with diet and everything, because it's a long program. So you need quick action. So irregular heartbeats, low pumping, ECG problems. So these things, I think we should intervene. Or repeated chest pain, then we should intervene. Otherwise, almost all of them, majority can be taken, 70-80% can be taken into this kind of program, like a dime, and nothing will happen. Moreover, we have the backup. We have got a team of, you can say, 500 heart surgeons in India. So we can refer them immediately. Okay, this guy is not responding, or he's having serious issues. So they will do the angioplasty or bypass surgery, Narayan Rudalaya or Fortis or Apollo or anywhere. So we have all the connections.
Great. So we not only watch their heart, we also watch their back in case they need any emergency support.
Front and back, yes.
I think this was the key question, Dr. Bhagia, from my side. Of course, there are a lot of other doubts that may be there. My request to all people who have joined the call, please call us, and we will see how best we can engage you with Dr. Suresh for either consultation, for the program, for the diet plan as well. And, see how we can transform your heart, your life with inputs from and guidance from Dr. Suresh Bhagia. So,
yes. Even if you don't have personally your problem, and in your family, I am sure, because it's so common.
Right.
So 1 in 4 is having some issue, after 30, 40, 50. we are getting heart attacks at 25 also. We get
Yes.
patients. So now it's very bad. Before the son used to bring the father, now the father is bringing the son
Yeah.
for the heart treatment. So very sad and bad. But yes.
No, thank you, Dr. Suresh Bhagia, for a very engaging. We usually conclude it in 45 minutes, but how 1 hour has gone by, I think very insightful. I like your, analogy that heart is like the battery. So if we are a mobile phone, we need to keep our battery charged, our heart charged. And I think
it works continuously for
yes,
40, 50, 60 years. There is not a single time it takes rest.
right.
Even
You
while
don't want to take rest.
it's beating, yeah. So we have to keep it healthy.
Yes.
Correct.
Yeah, over to you, Pradeep.
No, thank you so much, Dr. Suresh, for this truly enlightening session. I think your practical insights on those three pillars, the nutrition, meditation, and exercise. I mean, the simple lifestyle changes can play a powerful role in reversing.
Yeah, main thing is implementation. So,
Correct.
like when I take the person in the program, I personally go after him. I mean, like, I make sure that this fellow gets the result. It's like, you can say 99% like person gets the result. So I can even say like a money back guarantee. If this was a selling course, then I would offer a money back guarantee. So it's so hard proof. Yeah.
No, but I'm so thankful and glad, Dr. Suresh, because it's not very often that we get such clear and actionable approach from someone with that depth of clinical experience like you do, right? I mean, from everybody at my Assurance and Insure Joy, Rahul, myself, we deeply appreciate the time and knowledge you shared with us today. And it perfectly aligns with our mission at My Assurance to focus on prevention and empower people to take charge of their health.
Also, humbly stating, proudly, or I don't know, humbly stating, I am the only guy in India currently, the first and only pioneer maybe, heart surgeon doing lifestyle medicine. So not Delhi does it, not Bangalore. I know the people, Devi Shetty and Naresh Trehan, and so they are not doing lifestyle medicine, but I am the only person who is doing this thing. So it's a unique thing. It's a unique thing. Like most of them will do surgery because I have done thousands. I still do surgery, but I realized that this is a better option and it clicks with the human being.
Yeah.
They don't want surgery. Nobody likes
it.
Yeah. So it resonates with them and they are happy.
And doctor, from each one of us here, I think we want to wish you all the luck. I don't think 1 million is the number that you should target. It should be
that's a small
people.
number.
Right.
So we have got crores of people.
Crores of people that needs impact, and this kind of impact where surgery can be avoided, it should be avoided. Right. No. So thank you so much to all the attendees as well. Thank you for being part of today's session. We hope you are leaving with not just information but inspiration from Dr. Suresh to make small changes that can lead to big results.
There was a guy who raised the hand, Rishi or something.
Rishi.
If you want to take his question or something, if he's there.
Rishi, if you can hear us, please mention your question on the chat, or we can also unmute him. Sudhir, can you unmute everybody? If anybody has any questions, we can take it. Sudhir, can you hear me? If you can unmute everybody. Yeah.
They can raise the hand or something.
Yeah, Rishi, you can type your question. Yeah. Yeah,
Sir, good afternoon.
Yeah, Bhai.
So this was a brain opening, mind opening, and extraordinary session, sir. Thank you for taking that question. I just wanted to know one thing that you mentioned a book name Bypass Surgery, which is available in Amazon.
Yes, so you type it on the Google and you will get it. Bypass the coronary bypass surgery, Dr. Suresh. So you will get it on Google, Amazon.
Whatever things, yes, sir. Whatever things we have discussed
Yes.
book also. Hello?
Correct. Yes, yes.
Because my father is suffering from diabetes from last 6-7 years, and
Okay.
doctor has advised him to go for cholesterol also.
Right.
I was keen for him and uh, take care of him, and this was like a good session for me. And definitely, I will get in touch with you and Rahul sir also.
Sure.
So
Yes.
thank you for taking this session, sir. I'm glad to
Thank you.
be an attendee of this session.
Okay. Thank you.
Yeah, so I have Dr.
Thank you.
Suresh, I've just posted the Amazon link to your book in the chat, so people can, if they want to buy that book, they can buy that book. Yeah. So
This chart, this dark chart will also reverse that the diabetes.
So yes. So now remember one thing. This is a very simple, preliminary, basic diet which I have given. It's a blanket. But suppose somebody has got uric acid, somebody has got a different disease, liver disease, kidney disease, then the thing will change, and I actually give them like a daily chart. This is like a generalized diet chart for all the entire Indian population or the world. You can use it, it's fine. But when you join or specifically align with me, I monitor you personally and give you a weekly chart, which is like Monday, Tuesday, Wednesday, everything personalized. And because your parameters are different, your father's parameter is different, but it is got a different, so we have to do it accordingly. Some person may be on dialysis, kidney disease, so we have to treat accordingly.
great.
Yes, sir.
We do it. Yes.
I think
Definitely, sir. I will get in touch with you.
sure.
Thank you, sir.
Thank you. I think should we conclude, because Vidyasagar has a question, but I think it's if we can quickly answer, Dr. Suresh.
Okay.
Type 2 diabetes, what are the symptoms in terms of sugar readings? What are the values which, I think he wants to know, what are the values which then classify you as diabetic?
Indian Diabetic Association as well as American Diabetic Association, ADA. So they've got the norms. So if it is like around 100 or less in fasting, you are okay. And then 100 to 120, you are into the zone of diabetes. And more than 120 fasting is a problem. And for postprandial or like after meal thing, 2 hours, 140 is the cutoff point. So you're not diabetic. 140 to 160, you are pre-diabetes, and more than 160 after postprandial, you are labeled as a diabetic. But again, I will tell you, diabetes is not a disease. It is a protection mechanism of the human body because it is trying to heal. So we don't treat as a disease. You can reverse it very easily. So type 2 diabetes is not a disease. We have to remove that fear factor and treat it like a change in the body. High blood pressure is not a disease. It's a body's protection mechanism. Body is trying to fight back because there is a problem in the body and the blood pressure is raised. And if you suppress with the medicine, you are suppressing the natural response. So you have to treat the basic root cause. Then your body is healthy. So it's a very transient thing, like high blood pressure. If you see a lion, your blood pressure will rise. So it's like that. But it's a natural protection mechanism.
Right.
So same, you are under chronic stress, your blood pressure is high. So once you remove the stress, your blood pressure is normal. So we don't. So we eliminate medicine also. That's why we remove medicines.
Yeah.
Even though I am trained in hardcore pharmacology and allopathy, but I stop the medicines. of most of the patients who come to me.
Great. No, thank you, Dr. Suresh. I think we are much beyond our time, so we should wrap up, Pratik. Right?
Yeah. No. You're right, Dr. Rahul. So, Dr. Suresh, thank you again for these. I'll call them practical nuggets, and that blend science, tradition, common sense, all of that beautifully. Right. But to everybody, we'll see you again on the third Sunday of next month. That would be 18th May, with another impactful conversation. So until then, as we always say, stay healthy and stay proactive. Take care. Goodbye.
Take care. Thank you, Dr. Suresh. Thank you, everyone, for joining. Thanks.